Welcome to the Wellbeing and Health Benefits presentation for Postdoctoral Fellows. Your presenters today are myself, Amanda Swoboda, Wellbeing Specialist from the Human Resources Department here on the Okanagan campus, and my colleague, Jacky.
Hi, I'm Jacky, the Relocation and Benefits Associate, also on the Okanagan campus.
We would like to take this opportunity to acknowledge that UBC Okanagan is situated on the traditional, ancestral, and unceded territory of the Syilx peoples, the caretakers and stewards of the Okanagan. I identify as a settler Canadian and as such acknowledge that I am an uninvited guest on this land. As we are sharing information about UBC benefits that support and promote health and well-being, I am reminded of all the ways that living on this beautiful land and the resources that it has to offer has contributed to my health and well-being. If you are joining us locally or from another territory, we invite you to consider how the land that you live on has contributed to your well-being, how you give back to the land, and to take a moment, maybe now or later in your day, to reflect with gratitude.
Here's our agenda for today. We will provide information on the following topics: work, health, life, and the Employee and Family Assistance Program, also referred to as EFAP, the Medical Services Plan and private health insurance. We'll review the UBC benefits, extended health, dental. We'll briefly discuss the HR system Workday, where you can enroll for benefits and make changes to benefits. Then we'll discuss the insurance provider for these benefits, Sun Life Insurance, how to register with Sun Life, and how to submit claims. Then we'll provide information about the well-being resources such as the Work, Reintegration, and Accommodation Program, resources to support and promote mental health, and corporate discounts. Lastly, we'll provide you with contact information you can use if you have questions after the presentation.
Let's start by sharing some information about the UBC Employee and Family Assistance Program provided by Morneau-Shepell, or EFAP as it's commonly referred to. The EFAP is a no-cost, confidential health and well-being resource available to you. It offers expert information and immediate support resources available in person and by phone, video, web, or mobile app. The EFAP provides both short-term clinical counseling and work-life consultations to all eligible UBC employees and their dependent family members, again, at no cost to UBC staff and faculty. Let's talk about access. Here's what you can expect. Morneau-Shepell's Care Access Center is available 24 hours, 7 days a week at 1-800-387-4765. After phoning the toll-free confidential Care Access Center, you will be connected to an intake counselor who will collect information about the issues you are facing and schedule services based on any requirements you may have. For example, if you would like an appointment with a female counselor in West Kelowna on a weekend. Counselors can help with a range of issues, including relationship challenges, addiction support, stress, depression, anxiety, family issues, grief, and more. Services are available in multiple languages and formats. Emergency counseling is available at any time. If you are experiencing an emergency or crisis and require immediate counseling services, call the 1-800-387-4765 number and select the emergency option to speak to a crisis counselor. All Morneau-Shepell counselors have master's level training and 5 to 10 years of EFAP specific training. As part of the Employee and Family Assistance Program, Work-Life Support Services offers telephonic consultations and interactive online programs for enhancing relationships and navigating separation and divorce, family support for elder care, childcare and parenting, and support for new and expectant parents. Workplace and career consultations focus on stress management, exploring and maximizing your professional strengths. Financial covers areas such as debt and credit, divorce, mortgages, taxes, and more. Legal provides consultative assistance on family and property law, leases, civil law, and more. Health and wellness can connect you to nutrition support through a registered dietitian. And of course, there's more that it can offer. 2 smoking cessation programs are also available. To learn more about accessing any of these resources, go to the workhealthlife.com website and log in using your email and password, or get more information through the UBC Resources Benefits webpage. Again, the Employee and Family Assistance Program is free of charge, confidential, secure, and designed to be accessed at any time you feel ready.
All BC residents, including those on a work permit of 6 months or more, must enroll in the Medical Services Plan of BC, which is also referred to as MSP. This insurance plan covers medically necessary physician and hospital services. If you are new to Canada or BC, it is recommended that you apply as soon as you arrive in BC and establish residence. You can apply online with Health Insurance BC directly, and you can see the web address here. Please note that if you arrive from another province or country and apply for MSP, that there's a 3-month waiting period, which includes the balance of the month that you arrive plus 2 full months. If you arrive from another province and you had their provincial healthcare plan, it should cover your hospital and medical clinic expenses for those 3 months. If you arrive from another country, it's recommended that you arrange for private medical insurance during the 3-month waiting period. There are 2 private insurance companies listed here that UBC recommends: David Cummings Insurance and Sun Life's and Patriot Plan. Please review both insurance companies' coverages and choose the one that best fits you and your family's needs. More information about these plans can be found on the HR Benefits website. There are 3 health benefits available through UBC's Group Benefits Plan for those appointments that are eligible. The first 2, extended health and dental, are optional benefits, which UBC or your supervisor's grant pays the premiums for. As of January 1st, 2021, the health spending account will be an additional benefit through Sun Life. The third benefit, which is the Employee and Family Assistance Program, is a mandatory benefit, which UBC or your supervisor's grant will pay in full as of January 1st, 2021. To be eligible for these 3 benefits, one needs to have an appointment of at least 1 year or more, and the appointment must be at least 50% as well as meet the minimum salary earnings. Workday is the new human resources and finance software system that you can complete your benefits enrollment in and make any necessary changes to your benefits. It's accessed using your campus-wide login, also known as CWL, and your password. You will be automatically enrolled in EFAP on your start date at UBC, as it's a mandatory benefit, but you will need to log into Workday to enroll for the other 2 benefits, which are optional, the extended health and dental. You can add your dependents to your benefits, which also includes the Employee and Family Assistance Program. If you need to make any changes to your benefits, such as adding a newborn or changing your home address, you will need to do so in Workday as well. If you need assistance with Workday entries, please contact the Integrated Service Center, or ISC as it's known, who support Workday questions, issues, and requests. Here's a brief explanation of each of the extended health and dental plans. Extended health covers a percentage of the expenses for items such as prescription drugs or prescription eyeglasses, and for services such as physiotherapy or vision care. A provincial healthcare plan is a prerequisite for this benefit. Dental covers basic procedures for 100%, and then a percentage or specified limit for more complex procedures such as orthodontics. The health spending account is a new benefit added to the faculty contract with Sun Life as of January 1st, 2021. It provides an annual credit of $200 to reimburse for eligible expenses not covered under the extended health and dental plans. To learn how to make a claim or for more details about the Sun Life faculty contract, please go to the HR Benefits website. Next, we'll discuss the proof of coverage that you require when you visit a medical provider or pharmacy. If you visit a hospital or medical clinic, they will request proof of coverage for your MSP that includes your personal health care number or PHN. This proof of coverage will be in the form of a card called the BC Services Card or BC Health Card. After your waiting period is satisfied, you'll receive your BC Services Card from Health Insurance BC by mail to the address that you wrote on your application form. If you have temporary immigration status, please contact Health Insurance BC directly for more information. For any visits to paramedical providers, such as a dentist or pharmacy, you can present your Sun Life card. This card can be obtained after you enroll for UBC's extended health and dental plans through Workday. Next, you'll register with Sun Life at www.mysunlife.ca. When you register, you will need the group contract number and your UBC employee ID number as seen here on the slide. After registration, you can print out your Sun Life card from your account webpage under coverage information, or you can access it from the Sun Life mobile app. After you've registered with Sun Life, you can proceed with making claims for your extended health and dental expenses. For prescription drugs, paramedical services, and all other claims, you can present your Sun Life card to the medical provider so they can bill Sun Life for the covered amount. If they're not able to bill Sun Life, then the employee is responsible for paying the full cost themselves, and then submitting the claim to Sun Life for reimbursement via one of three ways: an e-claim online at the Sun Life website, or an e-claim on the Sun Life mobile app, or via a paper claim form to Sun Life. And this form can be found on the UBC Benefits website, Making a Claim. For dental care claims, the payment of your dental expenses depends on your dental office's billing practices and their arrangement with Sun Life. So you can either have the dental office submit the covered amount of the claim directly to Sun Life, and if they're not able to do so, then the employee pays the full amount to the dentist and then submits the claim to Sun Life for reimbursement via e-claim, the mobile app, or the paper claim form. And it's important to note that if a dental procedure or orthodontic treatment is over $500, a predetermination form or estimate must be completed by your dentist and sent to Sun Life for approval before the procedure is performed. If this is not done, the employee is responsible for what the plan doesn't cover.
Next, I'm going to share some information about some of our workplace health and well-being services and resources. The Work Reintegration and Accommodation Program, or WRAP as it's commonly known as, is a collaborative approach to injury, illness, and medical accommodation. If a staff or faculty member is sick, it is their responsibility to notify their head or supervisor or the designated administrative staff for their unit, and that their sick time is entered into Workday. If a staff or faculty member is off work for 5 days or greater, or if there are concerns earlier, like an upcoming medical procedure, the head or supervisor will contact WRAP. WRAP takes an early support approach to ensuring that staff and faculty have the resources and information they need to stay at work or return to work successfully. To increase knowledge of available resources, help manage stress, and support a campus climate that encourages free and open discussion about mental health, we have mental health literacy programs and initiatives. You will find self-paced webinars and courses like self-care and overcoming burnout in the workplace learning ecosystem, where you can learn as your time and schedule permit. Just go to topic and select Wellbeing. Our workplace health and wellbeing services offers a range of mental health training programs that will also be listed in the workplace learning ecosystem and the UBC Human Resources events calendar. With the 30-day mindfulness challenge, you can register to begin your practice on any Tuesday. It takes just 10 minutes a day, and the program is free and delivered online. Mindfulness can be a profoundly beneficial practice for our mental and physical health. It can also empower us to be more aware of our emotions and to approach people, situations, and life in a non-judgmental way. And the health, fitness, and family discounts, sometimes known as corporate discounts. Many businesses and service providers in the Kelowna area offer discounted rates to UBC Okanagan staff and faculty. Examples include TELUS, the Energyplex, and there's so many more. You just need to have your UBC ID card to claim the discount. UBC Ergonomics has great resources to check out, like the Home Office Ergo Guide and webinars, virtual assessments, and movement breaks. These are short videos to help you get more movement in your day. UBC Wellbeing has workplace, teaching, and learning tools to promote resilience, tenacity, and to help embed mental health literacy in curriculum. Worth a look. Benefits FYI newsletter, you are automatically enrolled in. This provides information and important updates about UBC benefits. The Healthy UBC newsletter, this you do need to sign up for. You will find engaging articles to support health literacy, information about events and initiatives, healthy recipes, tips for stress reduction, and more. The Assisting Colleagues in Distress. This tool provides 3 steps to recognizing signs of distress, responding with concern and empathy, and how to refer colleagues to appropriate services and supports. One of the quickest ways to find this is entering UBC Orange folder into your search engine. If you have questions regarding any of the content in this video, or if you would like to receive hyperlinks for any of the resources mentioned, please contact myself, Amanda Swoboda, or Jacky Ivins. The Graduate Studies Office also has a PDF copy of this presentation to share if you prefer. Thank you for your time and welcome to UBC.